Hey there, welcome to the September Continuing Education for CNAs. September is Sepsis Awareness Month. So this month we are going to talk about what sepsis is, the signs and symptoms of sepsis, and how to respond if you have a resident who you think is experiencing sepsis. So what is sepsis? Sepsis is an extreme response to an infection within the body. It's actually a chain reaction that's triggered by that infection. And the body releases chemicals into the bloodstream to help fight that infection. But in sepsis, those chemicals actually end up causing widespread inflammation throughout their body. Sepsis is a life-threatening medical emergency, and it usually starts before that person goes to the hospital. So that's why it is so important for us to be able to pick out those early signs and symptoms of sepsis so we have better outcomes. So what happens when someone is septic? So someone who is septic, someone who has that inflammatory response happening with that infection can also develop things like blood clots, or their blood vessels can start leaking fluid into the tissue that surrounds the vessels. And these two things can cause impaired blood flow to the tissues and the organs in the body. So this means that their vital organs, like their heart, their brain, their lungs, even their kidneys, aren't receiving enough oxygen. So that decreased oxygen to those organs can lead to organ failure, which can then lead to death if sepsis isn't treated quickly. So who is at risk for sepsis? Anyone who has an infection can develop sepsis, but there are some groups of people who are going to be at a higher risk. So people at a higher risk of developing sepsis. That includes the elderly. So studies show that over about the age of 60, your risk for developing sepsis increases. Infants and children are also at a higher risk because of their immature immune systems. People with weakened immune systems are at an increased risk of developing sepsis. That's people with cancer or people who have frequent infections and frequently take antibiotics, and people who frequently take steroids. All of those things increase their risk of developing sepsis as well. People with chronic health problems are at a higher risk. So that's things like diabetes, lung disease, cancer, kidney disease. People with recent surgery or recent hospitalization. So when we say recent surgery or recent hospitalization in relation to sepsis, we want to look back about 30 days. Have they had surgery or been hospitalized in about the last 30 days? If the answer is yes, then they're at an increased risk of developing sepsis as well. And lastly, people with long-term tubes like urinary catheters, that increases their risk of developing sepsis. So sources of infection, those original infections that trigger that chain reaction. That could be things like pneumonia, a UTI or a urinary tract infection, any kind of infection in their abdominal area or their bloodstream, catheter-related infections like a urinary catheter, infected wounds, infected pressure ulcers. But sometimes it's actually impossible for us to pinpoint what the original infection was that triggered that septic response. So how common is sepsis and why should I know about it? So each year in America, we have over 1 million adults who are diagnosed with sepsis. And of those million adults, about 350,000 die during their hospitalization with sepsis. So that's why early identification, early treatment of sepsis is so important. It decreases the number of people who experience those life-threatening complications or die from sepsis. And in a lot of cases, it's the CNA who is the first one to pick up on those signs and symptoms of sepsis. It's the CNA who picks up on something's not right first. So the signs and symptoms of sepsis, if someone has an infection and they have any of these other symptoms, those are things that should make you think we need to check this person out for sepsis. So if someone has an infection and they also develop things like altered mental status or confusion, typically the confusion that's associated with sepsis comes on really quickly. Or if they're sleepy, difficult to arouse, and you can't seem to wake them up, that's a symptom of sepsis as well. We tend to think of fever associated with infection, which is true. In sepsis, their temperature can raise above 100.4, but sepsis is tricky. So if they have an infection and their temperature drops below 96.8, that can also be a sign of sepsis. If they have pain or discomfort that's new and you can't relieve it, that can be a sign of sepsis as well. We also want to look at things like their breathing and their heart rate. If you notice that they're breathing very slowly or less than 12 times in a minute, or if they're breathing very quickly, more than 20 times in a minute, that can be a sign of sepsis. If you notice that their heart is beating very quickly, so more than about 100 times per minute, that can be an indicator for sepsis as well. If you notice that they have a weak pulse. And the last sign of sepsis that we're going to talk about is decreased urinary output. So if you'll remember that in sepsis, the vital organs aren't getting enough blood flow, so they're not getting enough oxygen, and that actually causes the kidneys to not work appropriately. So what happens is they don't produce as much urine in the septic process. So that can look like a resident who doesn't go to the bathroom as often as is normal for them throughout the day, or a resident who stays dry between several check-in changes. Both of those can be signs of sepsis. So if you think your resident has sepsis, what should you do? Step 1 is notify the nurse immediately. So remember that early recognition, that early treatment of sepsis is what's going to save their life. So you want to tell the nurse that you think the resident has sepsis and why. And then you want to be as specific as you can here. Mr. Johnson has a UTI, and today he's more confused and uncomfortable than he was yesterday. I think he might be septic. Or this resident has an infected wound and now they're having trouble breathing. I think they might be septic. Don't be afraid to use the word sepsis. Studies show that actually using the word sepsis leads to earlier recognition, earlier diagnosis, earlier treatment, and better outcomes. So don't be afraid to use the word sepsis. Then that resident is going to get further assessment from the nurse. They may need further testing and then treatment if they are experiencing sepsis. So how can I take care of my resident who has sepsis? Typically, we treat sepsis in the hospital or in the infirmary. We do things like IV fluids, antibiotics to fight that infection, and then other treatments depending on what complications they've developed during the septic process. So when they come home from that hospitalization or from the infirmary, then you can provide additional support to those residents who have had sepsis. You want to recognize that residents who've had sepsis are at a very increased risk for falls. And there's a couple of reasons for that. One of them is the confusion that can come along with sepsis. And the other is the weakness that happens just from being sick, maybe spending more time in bed than usual. And both of those things place them at an increased risk for falls. Their diet orders might change, especially if aspiration pneumonia was that initial infection that triggered sepsis, or maybe if they failed a swallow study while they were hospitalized. And then you want to continue to monitor your resident for changes in their condition or new symptoms. And if you notice changes in their condition or new symptoms, those need to be reported to the nurse immediately as well. So why is it so important that we recognize sepsis early? So evidence actually shows that the longer we delay the treatment of sepsis, we actually increase the chance of mortality or death from sepsis. So there's a study that shows that every hour that we delay antibiotic administration, we actually increase the chance of mortality or the chance of death by sepsis of about 8% for every hour that we delay getting them appropriate treatment and appropriate antibiotics. And that's why it is so important that we recognize it early and we get them early treatment. So in addition to how to treat sepsis or how to recognize it, how can you help prevent sepsis in the first place? And we say it all the time that frequent hand washing is the best way to stop the spread of infection, but it's true. Frequent hand washing, frequent use of alcohol-based hand sanitizers is the best way to stop the spread of infection. Hygiene. Assist your residents with appropriate hygiene. Assist your residents with appropriate hand washing. You want to keep their skin, their hands, their perineal area clean, and that helps decrease their chance of infection. And lastly, follow their diet orders exactly. You want to help your residents eat when they need help, monitor them for signs of distress during their meals. Doing that helps prevent aspiration, which prevents aspiration pneumonia. So successful sepsis prevention depends on us as caregivers. It's important that we know those signs and symptoms of sepsis so we can spot them early and we can get them early treatment. If they're confused or they're sleepier than usual, if their temperature is higher or lower than normal, if their heart rate is faster than about 100 beats per minute, or you notice their breathing has slowed down or sped up, those are all signs and symptoms of sepsis. If you notice decreased urine output or new pain or discomfort that you can't relieve for your resident, if they have an infection and they have one or more of those symptoms, they need to be checked out for sepsis. So, and then you want to remember who is at increased risk of developing sepsis. So that's the very young, children and infants, or the elderly. Long-term health problems, people with diabetes, heart disease, kidney problems, people with recent surgery or hospitalization. Remember, we want to look back about 30 days as far as recent surgery or hospitalization. Our residents with frequent infections, our residents that develop frequent pneumonia, they are at higher risk of developing sepsis. And then our residents who have urinary catheters are also at a higher risk of sepsis. Early communication about sepsis is going to be key to saving someone's life. So notify the nurse immediately if you suspect that someone has signs or symptoms of sepsis, and you want to be as specific as you can. Tell the nurse the specific symptoms you notice. Include any background information that might be important. Like Mrs. Jones does get frequent UTIs, but this one is different. She's sleepy. I can't wake her up, and her temperature is 96.4. I think she might be septic. And remember that CNAs are usually the first ones to pick up on signs of distress. Y'all know these people better than anybody else does, and y'all are the first ones to notice when something's not right. So important for you to be able to pick out those early signs and symptoms of sepsis so that we can get them early treatment and have a better outcome. Thanks for hanging out with me and learning about sepsis. Don't forget to complete your test, and we'll see you next month.